Nigeria's healthcare system faces significant challenges that hinder access to timely and quality medical care. The doctor-to-doctor ratio crisis, where you have one doctor per 5,000 people, limited healthcare infrastructure, resulting in overcrowding in hospitals, the high cost of care, and other challenges. For many, traveling abroad for medical care is a privilege reserved for the elite. However, doctors in the UK, such as Dr. Fumi Adewara, a multi-award-winning UK-based Nigerian-British physician, is using her expertise and resources to connect everyday Nigerians with premium medical care through telemedicine.
I saw technology as an enabler that could actually help Africa leapfrog her healthcare barriers. I continue to get calls from homes, from Nigeria, from people asking me for medical advice or asking to be connected to a medical expert who could diagnose them correctly, or because they needed a second opinion. So I was able to think about using technology because I'd seen how impactful it could be. We've seen it really change lives in the telecom industry, banking industry, where people can now do their mobile banking from the comfort of their homes, of their phones. You no longer have to go to the agent's office to book your flight. You could do it conveniently from home. So if we're doing that, and Africa, Nigeria is one of the fastest growing markets in mobile technology adoption, I thought, why not for healthcare?
A painful experience at a very young age in Nigeria helped change her life's mission, putting her face to face with harsh realities of Nigeria's healthcare system.
I grew up in Nigeria and my mom worked in the hospital, so I had a first-hand experience of what it means not to have access to healthcare, be it from the fact that we had shortage of doctors, we had overworked medical workforce, hospitals were far away, especially for rural, hard-to-reach areas, and we continue to lose thousands and thousands of people, especially children and women, to preventable illnesses. So that was what sealed my fate in medicine, and that was why I went on to study medicine.
Having over 15 years of experience in clinical medicine, she now sits as CEO of Mobi Health Internationals, a pioneering force in delivering cutting-edge telehealth and AI solutions to underserved communities.
We started November 2017, and now it's very, very encouraging to see the speed of adoption. We're still very far from where we need to be, but at least we have over comparably to where we've started, is over 500 to 1,000% increase in adoption of telehealth in Nigeria and across Africa.
Shuttling between Nigeria and the UK is Professor Hippolyte Amadi, a Nigerian engineer who is also visiting professor at Imperial College London. He's presently focused on frugal medical technology for low-middle income countries. His research involves the development of engineering tools to support newborn babies.
We focus more attention on neonatal interventions and innovations, because I believe that the neonates in the low and middle income countries of the world, where Nigeria is in, are highly neglected, they are abandoned, and they are not given enough and commensurate intervention as they demand.
His popular invention is a trio of low-cost solar-powered respiratory technologies for neonates, for which he earned the prestigious $100,000 Nigeria Prize for Science in 2023. He credits it all to the Imperial College in London, which has provided an enabling environment for him to carry out research and work with other scientists on his inventions.
It's possible I was able to coordinate all this care because from the Imperial College London, I have a very powerful computing power to be able to carry out research. And the advantage I have that when I come to Nigeria, I'm not a foreigner in Nigeria, I'm able to move around the country and do things myself. It's not just knowing the Nigerian patients through pages of newspapers or magazines or journals or the internet, but I know the Nigerian basically personally, and I'm able to examine patients myself make friends with the doctors and the nurses who will help me translate the medicine that I've created.
Dr. Adewara and Professor Amadi are testimonials of UK soft power used for the greater good in Nigeria. Mutual partnerships like these strengthen diplomatic ties and save lives that eventually impact future generations for good. Amarachi Ubani, Channels Television News.